Hi, everyone. Welcome to Facebook Live. I'm David Olajars, Manager of Media Relations at Henry Ford Health System. For today's topic, we're talking about the coming flu season and what that means when we're in the middle of a pandemic. We don't know what kind of flu season we're going to have this year. A little too early to know what that's going to be like, nor do we know what a potential second surge of COVID might be like. With these two viruses converging, it's important we start making plans now to avoid a potential twindemic. That's a new word this year that we're learning about in the flu lexicon this year. For this timely discussion, we have a panel of experts from Henry Ford Health System and our insurance partner, HAP. I'm pleased to welcome Dr. Allison Weinmann, an infectious diseases specialist at Henry Ford Hospital.
Hi, everybody.
Dr. Rena Daiza is a family medicine physician at the Henry Ford Medical Center in Bloomfield Township. And Dr. Peter Watson is the Vice President of Care Management, Quality, and Outcomes at HAP.
Good afternoon.
Welcome to you all. A quick reminder for our Facebook viewers and followers, see the disclaimer at the top of this thread and make sure to turn on your sound. So, doctors, I'd like to begin by asking each of you to offer some brief perspective on your utmost concern about the upcoming flu season. Dr. Weinmann, I'd ask you to sort of kick it off, followed by Dr. Daiza, and then Dr. Watson, please.
Hi, thanks, Dave. You know, there are a lot of concerns for this year, and we don't know what's going to happen, as you said. We worry about patients getting both flu and COVID together, which we think could be a very bad combination because each disease by itself can cause very significant disease and even death. We worry about our bed occupancy if we have a surge of COVID at the same time when we normally have a lot of patients occupying beds for influenza. And we worry about patients who had COVID who may not yet have received their influenza vaccine, and for the general community that hasn't received their influenza vaccine. So all of those things keep us up at night.
Dr. Daiza.
Hi, Dave. I guess I'll echo what Dr. Weinmann was saying. We know that COVID is still very rampant in the community. And during the summer months when it's a little bit more humid, it's more difficult for viruses to spread. And as you all know, we've reached over 200,000 deaths. So it's still spread very quickly despite the better weather. So now that the weather is getting cooler, we're going to be indoors more, we're going to be congregating more. We expect that the spread is going to be a little bit faster and a little bit easier. And now that we're dealing with COVID plus the flu plus pneumonia, it's really important to take those precautions. Like Dr. Weinmann said, getting your vaccines, very important. And then taking those health precautions, you know, staying away from others while you're indoors, because like, again, as the weather gets colder, we're going to be having to congregate indoors a little bit more.
Dr. Watson, please.
Yeah, thanks, Dave. I think that Dr. Weinmann and Dr. Daiza covered a lot of my concerns. I think, again, I would amplify my concern for our general population and those that are at high risk. And, but I think what I would add to that as well is I recognize that a lot of folks in our community are really weighed down by what we've been dealing with COVID this year. A lot of changes in our daily life, in our community, and the way that we seek medical care. I think it's very important as we go into the flu season for people to continue to adjust and be resilient, but take those proper precautions and understand how we can incorporate some of these best practices and precautions to remain healthy through the flu season as we anxiously await better therapeutics, a potential vaccine, hopefully sometime next year for COVID, to work hard to get through this flu period.
All good remarks. Thank you for that. Dr. Weinmann, so there's been some reporting out there that the flu season is, quote unquote, weirdly mild in places like the Southern Hemisphere and other parts of the world. Does what happened in other parts of the world translate to what we may see here in the United States?
We don't know, Dave, is a brief answer. We do look to the Southern Hemisphere every year to try and predict what flu strains may be prevalent. But as you know, the flu changes genetically quite a bit from the time it's in the Southern Hemisphere to the time it's here. So we never know ahead of time what the flu season is going to look like. We don't know how good the match will be for the vaccine. We don't know how severe the flu season will be. We do know that certain places in the Southern Hemisphere have taken a lot of COVID precautions like universal masking, which have not been adopted as well in the United States. So certainly masking and social distancing and hand hygiene protect against both COVID and flu. So we hope that there may be a milder flu season, but we are concerned about keeping people safe by getting vaccinated, which is the single most important thing people can do to prevent getting flu.
As a follow-up to that, Dr. Weinmann, on a basic level, can you talk about the difference between flu and COVID, particularly from the standpoint that, you know, as we know, they share similar symptoms?
They do share similar symptoms, and they can be tricky to tell the difference between. And there are also other respiratory viruses or infections with bacteria that can also look similar. So really, we look for prevalence in the community. So right now, what we're seeing is still COVID. COVID's still out there. It's not going away. We still have the vast majority of the population in Michigan, and the country is still susceptible to COVID. Right now, there's very little activity of influenza across the country. And when that activity rises, we'll certainly be more suspicious for influenza than we are now.
Dr. Daiza, when it comes to the flu, can you talk about 2 or 3 common things that people can do to reduce their risk of getting the flu?
Well, Dave, it's really the same thing that we've been saying over and over and over again. Remember, the flu is also a respiratory virus, just like COVID. So the main mode of transmission is from person to person. So very similar to COVID, you want to mask up, make sure that if you have to be in close proximity with others, that you wear your mask, especially if you're sick. Please stay home, talk with your doctor, get tested. Hand washing, super important. We've been talking about this again for months and months, but make sure that you get in between your fingers, underneath your fingernails, you're washing your hands for at least 20 seconds. If you don't have access to soap and water in that moment, you're driving, you're in your car, make sure that you use hand sanitizer with at least 60% alcohol. Again, the same things we've been saying over and over and over again. It's the same things that we said about COVID, they're going to be applying to the flu as well.
Dr. Daiza, is soap and water better than alcohol sanitizer?
I wouldn't say that it's better. Like I said, if you have access to soap and water, that's always my go-to, just because you know you can spend the time to wash your hands well. With hand sanitizer, again, looking for that 60% alcohol level. So just make sure that that's what you have handy. If it's not 60%, then I would say yes, probably hand washing with good old-fashioned soap and water should do the trick.
And Dr. Watson, we know flu is a serious illness and can lead to hospitalization, even death. Can you talk about how flu is treated and who are the most vulnerable populations we need to be really concerned about?
Yeah, so there is some overlap between flu and COVID as far as people at risk. We're still learning about the risk groups related to COVID because it's still new, but as far as flu is concerned, some of the specific subpopulations of folks in the community I worry about are people with heart failure, respiratory disease, diabetes, anything that might compromise their immune system. Certainly folks who are purposely being treated to suppress their immune system for autoimmune disorders or cancer are at risk. And there is some overlap of those risk groups with COVID to varying extents. So those are the folks that I worry about from a condition standpoint. And then the extremes of age. Even healthy elderly folks, we have seen this with COVID, have unfortunately been at much higher risk for hospitalization or death. And the same is true for flu, as are very young children. We cannot vaccinate children under the age of 6 months. And so part of the importance of vaccination for flu is not only for you as an individual to reduce your own risk, but to get vaccinated so that you're protecting others in the community who cannot be vaccinated. So there's a personal protection, but you're also helping your neighbors when you get vaccinated.
So before we go really deep into the weeds on our discussion, let's cover some flu basics, right? For our Facebook audience and our followers there on Facebook. And for those watching, we ask that you follow along with us and kind of play along with our true or false game here. These are all true or false questions. Doctors, I would ask that you sort of give a free a brief explanation with your answer. So Dr. Weinmann, we're going to kick you off first. True or false? A flu shot keeps you from getting the flu.
The goal is that the flu shot it's the single most important measure you can do to prevent you from getting flu. Can you still get flu if you get a flu shot? Yes, you can. The more people that get the flu shot, and the current recommendation, which has been for years, is that everybody in America over the age of 6 months gets a flu shot. The more people that get it, the more we hear about this herd immunity, where there's less flu circulating in the community. We also, as we said before, don't know how well the strains will match up with the flu vaccine. So yes, you can get flu, even though you've had the flu vaccine, but what you can't get flu from the flu vaccine because it's killed, especially the shot.
Dr. Daiza, true or false? I got a flu shot last year. Do I need one right now?
Yes, you do, Dave. And the reason for that is because we know that the influenza virus can change or morph year by year. That's the reason why we have this vaccine yearly. And just last year, we started with different types of flu vaccines. So there's, for example, a high dose if you're greater than age 65. We have a non-preservative and the regular one. So again, talk with your doctor about which one is appropriate for you, but definitely want to get the shot every single year just because of that change in the virus each year.
How soon should you get it, Dr. Daiza?
Well, we're offering it already. Yeah, we've been having it, I think, for the last at least 3 to 4 weeks. So we are very busy giving the flu shot. This year is a little bit different just because of COVID. The influx of people wanting to get the flu shot is definitely higher. That's a good thing. So you'll need to talk with your doctor, make an appointment, but we've already got it. So please come in and get your flu shot if you haven't already.
Dr. Watson, is it true or false that few people are hospitalized because of the flu?
Oh, well, certainly the flu hospitalizes many folks, even despite all the best vaccination efforts and all of the best precautions. We unfortunately do have a high volume of hospitalizations from flu every year. It can fluctuate, as Dr. Weinmann covered. The flu strains can vary from year to year, and some seasons are worse than others. But even in low seasons, even when everything runs well, we have a significant volume of hospitalizations from flu. But again, the more that we vaccinate, the more that we do masking, the more that we do some of the hand hygiene that Dr. Daiza talked about, we reduce the probability that folks get flu and potentially that we'll have less hospitalizations as a result.
Dr.
Weinmann, please. People with allergies, should they get a flu shot? True or false?
It's true. There's a flu shot for everybody. So there's a small component of egg in some of the flu shots. There's an eggless version so that people can have that, although there are some recommendations that the amount of egg in it is so microscopic that anybody can get any formulation, but there's a formulation to suit everybody.
And finally, Dr. Weinmann, the flu shot, will it protect me from COVID?
So no, the flu shot will not protect you against COVID. The flu shot only protects.
Oh.
Let's see, is that better?
Yep. That's good. All right, start again, please, Dr. Weinmann.
Sorry, the flu shot only protects against flu. It does not contain anything in it that is related to COVID. There is a myth going around that there's COVID vaccine in the flu shots. That's absolutely false. There is no COVID vaccine that has been licensed or approved for use, and there is not likely to be until mid next year widespread distribution of any COVID vaccine. But flu shots are a good thing to get, and now is the time.
Okay, so because of the pandemic and because we value the health and safety of our patients and our team members and to accommodate for social distancing this year, the flu shot's a little different at Henry Ford. I want to talk a little bit about the options that are available to folks who are going to be coming to Henry Ford for their flu shot. Number one, you can get your flu shot during a regularly scheduled appointment with your family doctor or your pediatrician. And then number two, you can schedule an appointment online for your flu shot at henryford.com or through your MyChart account. We welcome everybody who comes to us for their care. However, we do ask that you use one of these options to get your flu shot this year, and please do not just walk into one of our facilities. We recognize it's a slight change from our years of past practice, but we're living this new normal right now. So we thank you for your understanding and trusting us in your care. Okay, back to some questions for Dr. Watson. Fair to say that especially this year, that getting your flu shot early is more important than where you get it?
Yes, I would definitely recommend that you get the flu shot as early as possible. And I'm glad you walked through some of the steps for how our patients can get flu shots. I actually got on MyChart yesterday, and I'll be getting my flu shot tomorrow with 3 of my boys in the clinic, actually at Dr. Daiza's clinic building tomorrow afternoon. So I would encourage our patients and folks in the community to leverage our electronic resources at Henry Ford to get their vaccination. Or use retail outlets if that is more convenient to get that as soon as possible. It takes several weeks to get that immunity after the vaccination. You're not immediately mounting an immune response effectively to flu. It takes a couple of weeks. So I do recommend that folks get it earlier than usual so that they do have adequate protection from flu as early in the season as possible. But I always tell people it's never too late to get a shot. Don't feel that because a date went by that, oh, I'm not going to get it this year. It is never too late to get vaccinated, but please start now.
Dr. Watson, can you talk a little bit about the potential side effects of receiving a flu shot?
Yeah, so there are some minor side effects. Most of these are local. Most folks sort of recall they'll get a little bit of a stiff arm, or they may get some tightness or soreness in the arm where they got the shot injected. It is possible that they may have some very mild body aches and maybe even a slightly elevated temperature. These are actually all indications that you're actually mounting an initial response to that flu. So that's to that flu vaccine. So that's actually not an indication of infection. It just means that your immune system is actually responding to the immunization itself. And most of those symptoms are minor, usually self-limited within a couple of days.
Dr. Weinmann, for those who have recovered from COVID or perhaps just tested positive for it, what's your recommendation on those folks for getting a flu shot?
So patients who have recovered from COVID, we are concerned that they're at increased risk because at least some of COVID affects the lungs usually, although we know it can affect many other parts of the body. So we would urge those people to get immunized as soon as possible. They should be in line already, have an appointment, and be ready to get their vaccine if not already received it. If somebody is sick in the hospital with COVID, then we usually would wait either until their discharge time or shortly after their discharge to get their vaccine. And if somebody has a positive test, because we don't want others exposed to COVID, we would ask that they wait until their isolation period concludes before they go and get their flu vaccine, sorry.
Dr. Weinmann, do we know yet what the potential implications are if you get flu and COVID at the same time?
We don't know, but we know that each one of them, as we said before, carries significant morbidity and mortality. Last year, for example, was a bad flu season. About 59,000 people in the United States died of influenza. And in a light flu season, somewhere around 5,000 to 10,000 people in the US died from influenza. So influenza by itself can be a fatal disease. We can only anticipate, and what people die from with flu is actually pneumonia, flu pneumonia, or a secondary bacterial infection that makes their system a bit more prone to get a bacterial infection after flu. So we can only think that as people with COVID, and you've all heard about these people who've had long-term problems with their lungs, that if you get another respiratory virus on top of it that carries its own morbidity and mortality, that's going to be a bad combination and something that we don't want to have to fight.
And Dr. Weinmann, a quick follow-up to that. So if, in terms of testing for both flu and COVID, we know there are separate tests for each of them. Do we have the ability now to test at the same time for both?
There is an FDA-approved test it's one nasopharyngeal swab for both. We are concerned, as are many other people, about the supplies that will last for the flu season. So right now we're looking at our testing algorithms, as are most places in the country.
Okay, Dr. Daiza, earlier we talked about this symptom similarities between flu and COVID, right? But of course, it's also possible that your symptoms may not be flu, they may not be COVID, but they could be seasonal allergies. Can you talk a little bit about those differentiators between seasonal allergies and COVID and the flu, and even a cold for that matter?
Sure, Dave. Yeah, that's a tricky one because a lot of the symptoms between seasonal allergies, the flu, COVID, pneumonia, the symptoms really overlap. So allergies may be the easier one out of the others to differentiate. And I would say this to people, if you have a known history of allergies and you're experiencing very typical allergic symptoms like a runny nose, itchy eyes, the symptoms that you've had in the past, take your allergy medicine right away. If you're not improving over, oh gosh, maybe a day or two, then it's probably not allergies, because if that medicine is what typically subsides your symptoms, then we might be dealing with something else. Now, again, obviously we don't have a vaccine for COVID, but I'm just going to reiterate, we have a vaccine for the flu. Now, you can still get flu if you get the vaccine, but it may lessen those symptoms. We also have a pneumonia vaccine, which we didn't really talk about. Everyone greater than age 65 should have a pneumonia vaccine. And pneumonia is a little bit different because it's diagnosed by a chest x-ray and not through the nasopharyngeal swab like the flu or the COVID, but with the chest x-ray. But pneumonia, you can get pneumonia on its own, or it could be a complication as a result of contracting either COVID or flu. So getting the pneumonia vaccine if you're greater than age 65, but also if you have COPD, if you have asthma, if you're a diabetic, there are so many reasons why you may need the vaccine. So talk with your doctor because you could be eligible. So again, please vaccinate because it's very hard to differentiate. If you're sick, stay home or talk to your doctor about getting tested.
All good information. Thank you, Dr. Daiza. For our Facebook followers, you may have seen the wonderful infographic that we have on our Facebook page as we speak, which sort of spells out the differences between symptoms for COVID, flu, allergies, et cetera. And then also, if you guys are looking for information about any of these topics, you're welcome to call our My Care Advice line at 844-262-1949. Dr. Watson, picking up with you again, is there important information about flu shots that HAP members need to know specifically?
Yeah, again, I want to just reiterate what Dr. Daiza and Dr. Weinmann said. From a health plan perspective, HAP is very committed to immunizations across the board. I was really glad that Dr. Daiza brought up the pneumonia vaccine. That's another important sort of tool in the toolbox to protect our vulnerable population. So certainly, in addition to flu, for those folks who are eligible for pneumonia vaccine, that should be included. For our HAP members, we're very supportive of our partner with Henry Ford Health System from a vaccination standpoint. We do have resources on our website at hap.org to guide our members or anyone who wants to access our website around retail access to flu vaccine. I think, as was stated earlier, there's going to be a greater demand for flu vaccine, which we expected. And we want our members and folks in the community to access whatever point they can to get vaccinated. In addition to flu, all of those other necessary preventive immunizations. And from a plan perspective, we want to cover those at no cost for our members because it is important for us that those be covered appropriately.
Can you also talk about the telemedicine program that's offered through HAP?
Yeah, absolutely. So we do currently partner with an organization, Amwell, to provide online telemedicine services. We've also had a growing relationship with Henry Ford Health System with their on-demand services. So these telehealth services are in place so that for our members or folks in the community that need to access medical services that may not need an in-person visit, they can safely interface with a doctor or a practitioner to help meet their needs. They may still need to do an in-person visit as a result, but hopefully some of their issues can be resolved through that telemedicine visit.
And I know during the COVID surge earlier this year, Dr. Watson, there was some concern about whether HAP members could refill their prescriptions early on.
Correct.
That's still in play?
Yeah, so one of the things that I think has been a learning in this process with COVID is our ability to leverage mail order to better get medicines to people who may need them, particularly those folks, many of whom we've talked about already this afternoon, who are having chronic diseases and are high risk. You know, we focus on immunizations and other things, and those are critical, but we also want people to take good care of themselves for their ongoing chronic conditions through this challenging time. So we do have information through HAP to help our members access things like mail order so that they can continue to get their prescriptions, because that doesn't always necessitate doing a doctor visit, particularly if it's a medicine that you're normally taking that maybe has not changed. If there's been a change in your medicines, you might be able to access your doctor through telemedicine to get a dose change. Or if you have a clinical condition that needs further evaluation, you go in and see your doctor safely to get that medicine refilled or changed.
Dr. Daiza, if I have a mild case of the flu, what can I expect? And what are your recommendations for how to get better?
Well, Dave, the same rules apply. Even if you have a diagnosis of COVID and you have mild symptoms, you've got to stay home. You know, we have to protect our most vulnerable population, the elderly, the immunocompromised, patients with underlying conditions. So you are a vector. You can spread that virus to that population. So again, if you have symptoms and you get tested and you're positive, same rules apply. Isolate at the home for 2 weeks. Talk with your doctor about if you need a little bit more time, or you know what rules apply to go back to work or to get back to your normal life. But again, isolating at home, staying away from others, because even with your mild symptoms, you're spreading it to our vulnerable population.
And for those who have the flu, are there recommended over-the-counter meds that a person can take to treat their flu symptoms? Dr.
Yeah,
Dave?
so there's a couple ways to treat the flu. And again, I'm sorry, Dave. So there's a couple ways that you can treat the flu. If your symptoms start within 48 hours of diagnosis, then we have a prescription medicine that we can give you that may lessen the number of days that you have symptoms. But otherwise, it is a virus, and hopefully it will be self-limiting, meaning that, you know, just taking care of yourself in the home. If you're having a cough, if you're having high fevers, you can take, of course, over-the-counter Tylenol for the fevers permitting. You can take cough medications, over-the-counter medications, depending on what symptoms you have. And of course, you can talk with your doctor if you need more information on that. That should be enough for you to overcome the virus. Again, stay home, lots of rest, and even if you don't get that prescription medicine, hopefully over-the-counters will help you over that hump.
Great, thank you for that. We have a question from one of our viewers. This comes from Meredith. And I'm going to direct this to Dr. Weinmann, please. What do you say to kids who are afraid to get their flu shot because they may have a fever from a side effect?
So I'm sorry, I'm not sure I understand the question. So the children are frightened they're going to get a fever?
So parents who are maybe afraid to give their child a flu shot because they often get a fever as a side effect.
Yeah, oh, that's a good question. The fever that people get after a flu shot is usually very mild, and it usually only lasts a day. So, you know, I tell people if they've previously had a problem with a vaccine, like getting a little fever, when you go home, take some Tylenol, take it prophylactically, take it as a prevention, or take some ibuprofen or something like that. So it's nothing, these fevers are not the high grade fevers that we worry about in children where they can cause seizures and all that kinds of things. These are little fevers that really are often not really felt by the patient. If they are, they're pretty mild and they go away by themselves often.
So continuing along these lines, Dr. Weinmann, as everybody has noticed, we're in 80-degree temperatures here. Fall has started. Everybody's starting to hunker down, getting ready for the, winter season. Is there anything we can do at home to start prepping ourselves?
Yeah, I think that's really important, Dave. I think that, we've been very lucky that most of our surge happened during the warmer months. So for our own mental health, we could get outside, we could do a lot of socializing, socially distanced outside. I think that's going to become much harder as it gets colder. And I just want to encourage people, the good news is we know how these diseases are spread. It's by people being close together without a mask. And surfaces are important and hand hygiene is important, but not as important as staying away from people and masking. So what you can do at home is really stick to your bubble. Try not to combine other bubbles. Be creative about getting outside using heaters, going for a brisk walk, even if it's bad weather. Really avoid things like, eating out in restaurants. That's a very high risk activity, dining in restaurants. So I think people sort of just need to think ahead. It's going to be a long fall, and also as it gets dark earlier, how can I keep my kids amused? What kind of family time can we spend together? What creative things can we do online? And we're very lucky to have so many online facilities. So I think just a little bit of planning will help. And we are so lucky also to have so many ways we can electronically connect with each other and our friends and family. So I just encourage people to think about loneliness, think about social isolation, and think about planning ahead to make a plan for yourself for the winter and the fall.
Is there anything we can do at home to improve the air quality in our homes? Any suggestions from?
Yeah, there's not a lot you can do. You're in your bubble at home. Strictly speaking, a ventilated space is better. It's pretty hard advice in where we are to say, open your windows. I don't think that's very practical advice. I think that really you're in your bubble. I think you just need to stay within your home, make sure your home is as clean as it can be. If somebody obviously has symptoms, they should try and isolate themselves away from the rest of the family as much as possible. And they should obviously, as was said many times before, stay home. Don't give other people your respiratory viruses.
Dr. Watson, let's talk about mask etiquette. So I'm going to put my mask on right now as you sort of walk us through our mask etiquette. Let's begin though with asking you, is a disposable mask more effective than one of those reusable masks, the cloth mask?
Yeah, so we're still learning a lot about masking in general. I think what is uniformly true, and we have data from around the world to support this, that masking is truly a effective preventive measure from stemming spread. There have been various studies around disposable, reusable, and other things. I think the advice that I often am giving others is reusable masks can be helpful because you can clean them and do that on a regular basis. Certainly some people prefer one-use masks or single-use masks similar to the one that you have here. I think the important thing is that you're consistent in your approach. If you prefer to have a single-use mask, which means you're going to have a lot of them and not reuse them over and over again, versus having more of this is a cotton reusable mask that I have that I can wash every day or two and keep clean, because you can accumulate debris and things on those masks. But the bottom line is to have a consistent approach and stick with it to reduce your risk of transmission.
And talk about how I should wear this mask. What's the right way to wear this mask?
Well, if they're looking at you right now, that's the way to wear it. So when you're putting on a mask, it's important that the nose and mouth are both covered at the same time. I do unfortunately see folks out in the community who have it drop down or all the way down. Having it down around the chin is not protective. Having it around the mouth is only covering one opening. You're still exchanging a lot of air and moisture through the nose. It is, I think, a little bit more ideal to have a looped mask as you do, because it's going to keep it more securely in place. I do see some folks who are wearing sheaths or scarves. Those do, as long as they're blocking the nose and mouth, those can be effective. The only issue is they can loosen up and they can sometimes be more prone to dropping. So I think the bottom line is both nose and mouth consistently covered. The material is not as important as having it covered consistently. If you use a single use mask, it's not going to be that effective after multiple uses. So if you use something like a washable mask like this, that allows you to use it a little bit more long-term throughout the season.
Dr. Daiza, we saw at the height of the COVID surge earlier in the spring, everybody was sort of stocking supplies, hoarding toilet paper, paper towels, et cetera, from grocery stores, et cetera. Any recommendations for folks as we head into, you know, the fall and winter season? Any particular things that you would recommend people stock up on, you know, for during the flu, for the flu season and even another surge of COVID?
Yeah, it's a good question, Dave. I get asked that all the time. I will say no hoarding necessary, please. But it may not be a bad idea to have some non-perishable food items in the house because, of course, we never expect to contract the COVID virus. And if you do and you suddenly have to be isolating in the home for 2 weeks, it would be nice if you had those items already in the home. Of course, if you have family members that can shop for you, and now we have all kinds of like online services to get food, but just having some non-perishable items is helpful. I do want to piggyback on one thing Dr. Weinmann was talking about earlier, things that you can do to protect yourself. Now, I'm primary care, so I focus a lot on preventative medicine. So just very briefly, you know, please eat well, take care of yourselves, sleeping well, good sleep hygiene. These are all very important things. Taking care of your mental health. If you do these things on a regular basis, it will help to boost your immune system and, of course, protect you in the event that you do contract the virus to help fight it off quicker.
Dr. Watson, coming back to you. In addition to your administrative role at HAP, you are a hospitalist at Henry Ford. In your role, you've seen the effects of flu, you've seen the effects of COVID. What's the discussion like between you and your colleagues right now as we, you know, head into the flu season?
Well, I do still work a little bit clinically as a hospitalist and took care of patients, particularly in March, April, and May during the peak. Henry Ford did an amazing job. The nurses, the frontline staff, the doctors, in all the various departments. Dr. Weinmann and her team in infectious disease were outstanding in supporting all the clinical teams because our clinical guidelines were changing almost on a daily basis. I think the things that we learned were really using science to guide our care. And this was very challenging for the system and for our systems nationally because we were learning about a new disease as we went along. But I think it was remarkable what the clinical teams did in taking learning from almost every single patient that they saw and drove it back into our guidelines as we moved along as a health system. I think one of the things, and again, I'm glad Dr. Weinmann and Dr. Daiza piggybacked on this, is mental well-being and mental health. Our frontline workers, they need to take care of themselves. They are under tremendous strain. And I extend frontline workers to all those people who support our community, people who work at the grocery store, people who are delivering packages, our postal workers, people who really don't have a choice not to interface. So I think what we all think about as health professionals is the health and well-being of our community as a whole. And I am very confident that all of our health systems are continuing to retool on a daily basis to be prepared for what lies ahead, because we learned a lot in the spring and we got only better as we moved along. And that was just an amazing thing to be part of and to continue to be part of.
Dr. Weinmann, your thoughts on what's ahead?
Well, I think there's some good news here. The good news is that even though we are all fed up with the new normal, and this is the new normal, that we know how these diseases are transmitted. We have a much better understanding, as Dr. Watson said, than we did at the beginning of COVID. We have a lot more knowledge about what treatments are successful early on and what treatments are not successful early on. So we have a lot more confidence in our ability to handle COVID. And I agree. I think one of the biggest challenges going ahead, as I mentioned before, and others have, is mental health of both all of our frontline workers. And I agree, people who did an outstanding job and were very courageous about it, because this was a disease at the beginning that healthcare workers were getting infected, and we were frightened, understandably. And again, I include everybody that Dr. Watson talked about, all those other very essential services, grocery workers, etc. So I really do worry as the days get shorter and colder. And I, like I said, I can just reiterate, I think the best thing we can do is have some sort of plan. How can I make the day fun? How can I make this something to look forward to? I know fire pits have sold out across the country, but think about creative ways to get outside and socially distance. And, okay, so bundle up and go for a walk, even if it's cold and miserable out, buddy up with somebody else and go for a walk.
So that's a good point, Dr. Weinmann, because that's going to transition now into our final question. We only have a few minutes left for our Facebook Live here. So I wanted to sort of go around the room and ask you to offer up some final thoughts. And Dr. Daiza, will begin with you, and then Dr. Watson and Dr. Weinmann, please.
Dave, I really want to hit home taking care of your mental health. Aside from taking care of sick patients, physically sick patients, I see a lot of patients who have mental health issues, people with underlying anxiety and depression that are just very highly exacerbated at this time. Unprecedented times. I know we hate hearing that term, but that's what we're living in right now. So check on each other. I really like Dr. Weinmann's idea of having a new schedule and getting in a new routine, because our old routines were clearly disrupted. So, if it's exercising outdoors, finding a partner to exercise with indoors, like a family member, eating healthy, taking care of yourself, checking in on one another. If you have an elderly person who lives alone, call them regularly. Make sure that we are noticing little changes in people's behavior. And if you yourself are feeling down, anxious, you're not alone, and call us. And that's what we're here for. I see it every day in my clinic, and I'd like to see you too if you're having any of those thoughts or issues.
Dr. Watson?
Yeah, Dave, I think what Dr. Daiza said, I just want to second that really quickly. I think COVID has taught us how we stand together as a community, and we need to continue to do that as we go into what will be another challenging period with flu and COVID and the uncertainty ahead. So continue to look out for one another. One of the things I think our listeners should be thinking about too is I want them to trust our health systems and the people who all work together. I've been in practice now for over 20 years, and I have never experienced anything like this. Physicians just have not. This has really been a challenge, but I've seen our system and systems across the country just be at their best. And no one has stopped thinking about how they can be successful in helping our patients in our community get through this. And I need our listeners to trust us on that. Everyone, the health plan, the system, hospitals, everyone is working very hard to get us through this period. And we need you to trust us on this and work together and watch out for your neighbor.
And Dr. Weinmann?
I really second what Dr. Watson just said. I think we need to have confidence in sources that follow the science. And I think that our healthcare system has been very careful about following the science. I think that that's going to lead us out of this mess that we're in. I would encourage people, again, don't lose heart. This is a time to double down on masking, social distancing, and hand hygiene, and added to it, make sure you get your flu shot. And if you do all of those things and look after each other as a community, those are all, to me, community responsibilities, as well as your own personal and family responsibilities. Just part of being part of a community. You want everybody to be as well as they can during this really difficult time. So we hope people will reach out if they're having trouble. We're here for you. And stay well and healthy, everybody.
All good information. Thank you, Dr. Weinmann, Dr. Daiza, and Dr. Watson. And I also want to thank our Facebook viewers and their questions that they have shared with us. For more information about our discussion today, you can go to henryford.com as well as hap.org. And before I sign off here, remember the 4 things that we just talked about. Get your flu shot, wear a mask, social distance, Wash your hands. Have a good afternoon, everybody.